Fluoride has been in American water systems for generations, but that is changing. Last week, Utah state legislature approved a bill to ban fluoride in public water. It is expected to become law. It follows a national trend. According to NBC, since 2010, more than 150 towns and counties have voted to keep fluoride out of water systems. And the new U.S. Health Secretary, Robert F. Kennedy Jr., is on the record saying fluoride is linked to some illnesses. Those claims are disputed by almost all major medical associations.
So joining us now to talk about the fluoride debate is our 9 News medical expert, Dr. Pyle Coley. Thank you for being here. Why, I guess, let's go back to the beginning. Why did we put fluoride in our water to begin with? Isn't it good for you?
I mean, we have been doing it for decades. It started in the 1940s because people were having very rapid accelerated tooth decay. And the American Dental Association and others, the CDC, said, let's put it in the drinking water. And there were two reasons for doing that. One, fluoride, as we know, is really good for our teeth. It helps with remineralization. It prevents demineralization and actually affects the bacteria in our mouth so that they're less likely to make acid that breaks down our teeth. So the point of putting it in the water was to level the playing field because there are socioeconomic groups, poor income groups. When you don't have money, you don't go to the dentist. Right? So putting it in the water was really to say, okay, let's prevent tooth decay. And it's considered one of the greatest advances of the 20th century, actually, to have fluoride in our drinking water.
So where's the miscommunication? Or I should say the misinformation coming from, because I go on social media and I'm seeing debates left and right. So I'm glad that we have an expert here. What is the debate?
Yeah, so there's two controversies really here. So the first is, I would say, a lack of informed consent. You're doing something to me that I did not authorize by putting it in the drinking water, and I should have autonomy on whether I want this in my drinking water or not. So that's kind of the autonomy portion of it. But the second is it causing medical harm? And fluoride in excess can cause toxicity. But of course, the fluoride put in our drinking water is monitored very carefully. The concentration is kept at 0.7 parts per million. And the idea here is if we're getting too much of it, is it affecting either causing toxicity or affecting the neural development, especially in our children? So now there is some science behind this. There was a JAMA pediatric study that looked at fluoride in kids' urine and adults' urine and their IQs. And the more fluoride you have inside you, the lower your IQ. But all the fluoride doesn't come from the drinking water. You get fluoride from other sources as well, and other types of foods and things like that could potentially be a marker of other behaviors that are not good for you. So it's not clear that the closely monitored fluoride in the drinking water is actually affecting our children in any substantial way.
So where do physicians stand? Because now I'm confused. I'm like, that makes sense, that makes sense. What's going on? Where do you stand on
this? This is the greatest advance, the top 10 greatest advances of the 20th century. It is leveling the playing field and taking it out of the drinking water based on very shaky observational science, even though authors that did that study didn't suggest taking it out of the drinking water. They just said you have to watch how much fluoride, especially young children under 6 months and such, are getting. So we should not be taking this out of the drinking water. I think that would be a huge mistake. And the fact that we're doing it now, more and more people are opting out. Utah might be doing it. We're going to start seeing more tooth decay and more problems. Now, we can also get fluoride from toothpaste. So if you're using a good toothpaste with fluoride, you can make up for it from there. You can get it from certain foods, like I said, shellfish and tea and other types of foods. But now we have to start thinking about it. Right? And when it's not causing harm, we haven't demonstrated harm, doing something that is going to cause harm unless somebody does something else to mitigate that, to me is a mistake.
Well, Robert F. Kennedy Jr. has said in the past, too, regarding toothpaste, to opt for the fluoride free and not to have those additional fluoride treatments on your teeth when you go to the dentist, right? Like they painted on my kids' teeth to remineralize their teeth. So what would you say in regard to fluoride being in our toothpaste as well as when you go to the dentist?
I would say that our consumption of sugar-based products has gone so far up, and RFK would agree with me on that, and that creates acid that decays our teeth faster. So losing your teeth is a big deal, and it's not just because of cosmetic reasons, because of practical reasons, but bad tooth infections can lead to heart disease, heart infections called endocarditis. So we're starting down a slippery slope here. We're starting to take away things that have really helped populations as a whole, especially the underserved populations that don't have access to go to the dentist, that don't have insight about whether they should choose a fluoride-free or fluoride toothpaste, and I think this is a mistake.
Dr. Coley, thank you very much, as always.